Oh, this occurred to me on the other video toward the end when I was talking about assessing as the first uh, option. If you see an option that has assess, they want us to do that first, almost always. I can't even imagine a scenario where assessment isn't the first thing you should be doing. But it got me thinking about what helped me in nursing school. If you can, I mean, you have to get your BLS. Definitely, you have to get your BLS. But I also happened to get my ACLS, ACLS at the same time. Not the same time, but like later on in my in nursing 4, I got it just before nursing 4, and that helped me a lot in nursing 4. I don't know if your school is going to follow the same pattern where advanced med surg cardiology, a lot of the cardiology stuff is in the toward the end of the program. I think most of them follow that protocol because once they release you, cardiology is one of the main things out there. Take ACLS if you can. If you can afford it, or at least go over those books, because a good portion, I would say 25% of my last semester was cardio stuff. So when the test came on us, on that, I knew it. I was like, oh, amiodarone, of course, 150. Well, it's push, slow drip, or whatever. I knew it. Oh, it's epi, of course. I knew it already. And it gives you a nice thing on your resume to say, oh, of course you got your BLS. Everybody has the BLS. Sorry, you don't graduate without your BLS. You don't get into nursing school without your BLS. I'm pretty sure that's pretty much universal. But having your ACLS is something else. Having your PALS is something else. I want to go for my PALS next, but I'm just busy onboarding right now. But that helped me so much because it was like a review. And in clinical, it helped because I knew a lot of stuff. I was the one answering stuff because the professor would say, okay, what kind of anti-arrhythmic are we going to give them, the patient? And I say amiodarone, probably, right? And she's like, oh, I didn't know that. So that definitely helps. And you need it. Well, you don't really need it, but I think we should have it. Again, in another video, I was saying, NCLEX is pass-fail. Nursing school is basically, in the end, pass-fail. It's just to see if you're good enough to be licensed and take NCLEX. To become an excellent nurse, to become the A-level nurse, that's up to us. To get our certifications, to get our education like I'm doing today, to training beyond that. Listen during precepting, into training, when they're educating us. Listen and pay attention and study that material. Yes, you got to learn to do your med passes and mechanical stuff, but at the same time, try to learn why. And it's hard. It's hard. First part of orientation is just getting your muscle memory into it. It's like, okay, I get up at this time. I get dressed this way. I put on my badge, my supplies, and I punch in. I go here and there and whatever. I check in. You're just learning that process. I'm finally getting to the process after 2 months in, I think, of getting to diagnose a little bit and say, okay, this is why we're giving Paxil or whatever. Not to give it too much any HIPAA HIPAA violations or anything like that. And I'm not. Obviously, there's no names, there's no facilities or whatever. But you got to better yourself. So ACLS is great for nursing school. Yeah, as a nurse, it's great. But at nursing school level, that would help. Doing those things that later on, even if you don't get it, you can get the book or listen to the videos online. That's what I did. There's a number of them. There's a couple small creators out there that I subscribe or I watch the video of, and they're great. I think one was a hijab nurse. She does a really quick, nice ACLS review. It's like 5 minutes, like this, maybe 7 minutes, but it was good. She reminds me of Anne Hathaway. I don't, total. I was like, Anne Hathaway's a nurse now? Whatever. Sorry. But do those things. Better yourself. Get your certifications. That takes 2 years later. Don't worry about that so much. But you can do ACLS, PALS, refresher courses like that. That definitely helps. Okay?